Today we're going to talk about the Shingrix vaccine and shingles. So hopefully it'll answer any questions you may have and also provide you with information about getting the Shingrix vaccine. So first of all, let's start off with what is shingles. Well, shingles is a virus. It's caused by the herpes zoster, and it's a reactivation of the chickenpox vaccine, the chickenpox virus. So if you've had the chickenpox, it stays dormant in your body, and it can then come back as shingles. Why it happens to some people and not others, we don't know. For some reason, it stays dormant in the spinal column, and then for some people, their weakened immune system, but we don't know why, but some people will develop the shingles. About 1 out of every 3 people in the United States is going to develop shingles at some point in their life, and that equals about 1 million people per year. We do know this is as people get older, the chances of them getting shingles does increase. Now that's not to say that somebody 30 years old can't have the shingles, but it's more common as we get older. If you do have a medical condition that weakens your immune system, like leukemia or cancers, lymphoma or HIV, those are just some of those medical conditions that would weaken your immune system, the chances for getting it again would be a lot more likely. If you take drugs also that weaken your immune system, that would also contribute to that. So what can you do to prevent yourself from getting the shingles? Well, the best thing to do is really to get vaccinated. We've got the new vaccine, the Shingrix, that we're going to talk about today. It's very effective. Or don't get the chickenpox. But for most of us, by the time we're our age, we've had the chickenpox. Or we've been vaccinated against that. But one thing that's important to tell people is that you can't give somebody the shingles. Say, for example, if I had the shingles, I could not give it to you. What I could give to somebody, if I have the rashes active, I could give a small child chickenpox. So you as an adult, if you get the shingles and you have small grandchildren who have not yet been vaccinated against the chickenpox virus, then it would be important for you to stay away from that child for a period of time until you're no longer contagious. Okay. Chickenpox can give somebody the chickenpox, though, but they can't give you the shingles. So if your grandchild were to have chickenpox, they cannot give you the shingles. That's not what causes the reactivation. So signs and symptoms include, well, a lot of people before the rash starts, they feel a funny tingling or itching sensation or like a little pinch in a certain area of their body, and that's going to happen before the rash appears. And then all of a sudden they get these little tiny bumps, and the rash starts to blossom, as I say. It's not uncommon for people to have headaches, and they call it photophobia, where your eyes are sensitive to the light, and it's really actually uncomfortable. For the most part, shingles will go on one side of the body, and you feel it, or one side of the face, and it's very uncomfortable for people. And once that starts happening, at first you might not know why this area is really bothering you, and it's feeling like pinchy and all that. Then all of a sudden you're going to get this little rash, and people oftentimes say, "Oh, did I get some poison ivy, or did I come in contact with something?" But when you get to that point, just go see the doctor, because the sooner you can start on medications or have him see it, the better off it is. We do have a lot of complications from having the shingles, and one of them is the post-herpetic neuralgia. Some people will say that they've had the shingles, and then it's the pain of that does not go away. And for some people, that is very common. And it's a persistent pain. It can last weeks, months, or years. I have talked to some people who they always feel a little sensitive in that area, or they say they have a flare-up of it. The side effects from that post-herpetic neuralgia is in about 13% of the people over the age of 60. So we really want to keep an eye on that. If you do get vaccinated, regardless of which vaccine you have, and you end up getting the shingles, because nothing is a 100%, it does say that will help that post-herpetic neuralgia pain. But we worry about shingles when people get it on their face. especially, because then it can get into the eye, and that can cause bad eye involvement. You can get a rash at the site. You can get cranial nerve palsies, meningoencephalitis, because the meninges are at the base of the brain if they get involved. Lung involvement, your renal area, your kidneys and things like that. So we really don't want to really would like to prevent ourselves from getting the shingles, because even though the complications can be rare, they can be severe for some people. So there are 2 vaccines that people have been getting, and the one that most people have had is the Zostavax. That's been available since 2006. That's a live vaccine, and that goes into the fat in your arm. So you might have noticed that when you got that, a lot of people got a lot of redness or their arm really hurt. But that's a subcutaneous injection that's given once, and it's about 50% effective. So people say, well, it's only 50% effective. I try to say, well, it's 50% effective. If somebody offered me 50% of $1 million, I'd be really happy with that. So 50% of not getting the shingles would be great. However, now, since 2017, we've got the Shingrix vaccine, and that's the one that we're talking about today. And that can be more than 90% effective, which is very, very high efficacy rates for a vaccine. That's a recombinant vaccine. That's what they call a dead vaccine. So that one does go into your muscle, and it's recommended for all adults age 50 and over. If you've already had the Zostavax vaccine, there's no reason why you shouldn't get this vaccine. It would be actually good, because then you got one that's at 50%, one that's at 90%, so your chances of getting shingles would be even less. So the Shingrix vaccine is the newer vaccine. The difference with this one and the other is this one you need 2 doses, and they're scheduled 2 to 6 months apart. The downside to it is right now there's a nationwide shortage, and I know that a lot of people are trying to get the vaccine and they're having a hard time getting it. Once you get the injection, some of the things that we've been noticing people say is that their arm is sore and they have a little bit of pain, which is common with a lot of immunizations. I try to tell people, you're getting a shot, you're getting an immunization, expect to have a little soreness. Sometimes people feel tired and muscle pain. Those are reactions because you're trying to attach your immune system, you're trying to build immunity, and it's like you're fighting when you fight a cold, you feel a little tired. Some people get a headache, mild fever, so that would give you a little bit of chill. Rare times people complain of stomach pain or nausea. The side effects usually go away after 2 or 3 days, and it's actually, believe it or not, more common in younger people. I'm not sure why. I don't know if it's because their immune system is a little stronger and so they have a stronger immune response, but I'm not sure why on that. But 1 in 6 people got side effects that kept them from their regular activity, and the majority of those people is that their arm was really sore. So, how can you get the vaccine? This is the big question. Well, you can check with your doctor first, because some doctors do have it. Pharmacies get it in, but again, just like with everywhere else, there is a nationwide shortage, so it's almost like you gotta be in the right place at the right time. We get some at the East Shore District Health Department also. We get small quantities at the time, so we do keep a wait list, and we can work with people on that. And one good thing is that the Medicare your Medicare insurance will cover part of it. So depending on your plan will depend on how much your copay is going to be. And anybody with private insurance, East Shore District Health Department doesn't take the private insurance, but the pharmacies may, and you would definitely want to find out what your copay is going to be before you get the shot, because it's not an inexpensive vaccine, because it is new. It's not inexpensive, so you don't want to be hit with a bill that you're surprised with. So now when the East Shore District Health Department does it, we can provide it. If you call us up, or if you provide us with the information, we need your full name, your date of birth, and the last 4 digits of your Social Security number. And somebody had asked a question before, it's your Social Security number, not the last 4 digits of your Medicare number, because I know those have recently changed. So the last 4 digits of your social, and then what will happen is we can look it up, and then we can tell you what your plan is going to cover and how much your copay would be. And yes, it's a copay for, it's 2 separate shots, so you would pay for the shots separately and individually. And we talked about before, in case somebody is gets their shot during the summer here, and then they go down to, say, Florida for the winter months, and they're 6 months is in within that time, you'll have the information, and your copay should be similar. Yes?
If you have supplemental insurance, does that enter into it also?
Supplemental insurance may enter into it if you go to a pharmacy, but as far as at East Shore, no, it would not take into consideration. Not at this time. Do we have any other questions as far as the vaccine goes? If you did go to get a shingles shot, and sometimes what happens is that people get a shingles shot at the pharmacy, and if you went there and you asked them for the Shingrix, but they didn't have it and they gave you the older shot, the Zostavax, if you had that, you do need to wait at least 8 weeks between the two in order to get, then all of a sudden you get a call that the Shingrix is available. You have to make sure that 8 weeks is at least passed before you have another shot, minimum. Any other questions? So I have your handout, take a look at that. We have some things in the back of the room for you if you're interested, and anybody who provides me with that information today that we said before, full name, middle initial included, please, and then your last 4 digits of your social security number, your date of birth. We will look that up on the system to see what your copay would be. And please include your phone number, because that way we can call you back and let you know what the situation is. We also do a lot of other immunizations at East Shore District Health Department. We have a travel clinic. So if you're actually planning on traveling anywhere or going places, a lot of the travel agents will tell you that you really should check your destination and see if you need any additional immunization. I have a lady who called this morning going to Machu Picchu, Peru, and she really should have a typhoid shot and have other immunizations before she goes. So that's one thing to let you know that we have. And our flu clinics are coming up, and we take a variety of insurance for that, private insurance, including United Healthcare, which a lot of flu clinics don't take that.
And one of the pharmacies that I spoke to had a great plan that they didn't have the vaccine on hand. They have a wait list like most pharmacies do. However, what they'll do is, because you need 2 vaccines, or 2 administrations of that same vaccine, when they put you on the wait list, they automatically secure your second dose, so that when you go in for the first dose and you're on that wait list, they automatically have you on the wait list for their next delivery, because not all pharmacies will do that. So you'll get your first dose, and then you're waiting for the second dose, and it hasn't come in yet, or other people in the community have gone, when the supply comes in, they're getting their first dose.
Right.
So one thing I think that's good to ask a pharmacy, if you choose not to go through East Shore Health and you choose to go through a pharmacy, is, will you secure my second dose rather than giving a new person their first dose?
Yeah, I think that's a good plan. However, because of the shortage, to say you're guaranteed that second dose by such and such a month might not be as easy as that. But because there is, the second dose is 2 to 6 months later, for the most part, it shouldn't be, if people are keeping track and if you make sure you're on that next wait list, people, when you get a shot, they automatically get put on the next wait list unless they know they're not going to get it. Problem that happens with that is that people do have a reserved spot, and then all of a sudden 2 or 4 people from that list end up getting it somewhere else. And then those spots, there's a lot of reserved vaccine and people are being turned away for their first dose because they're not able to get that. So it's really important. Communication is very important to do. And it's really hard for a pharmacy who provides vaccines to a lot of people to keep track of your shot. Really, a lot of times it's important for, when you start getting to that 2-month, get yourself back on that waiting list. And if they call you early, tell them, oh, I need to go on the next one. I usually tell people to call about a week before the second one is due to make sure they reserve it so that they get on that next wait list. It depends on how long their wait lists are.
Do we know why there's a shortage?
I don't know why. I just imagine it's supply and demand. And the more people want something, the less of a availability there is of something, the more people always want it too.
Right.
So, but I do know that we got something that said that we are starting to get some of the vaccine in.
Right.
And we get like 10 doses at a time.
That's what Rita had said, about 10 at a time.
About 10 at a time. So, and we do try, if we do 5 and we've got 5 people that are waiting, we try to make sure that we contact the people that are due, if we can reach them. If we can't reach them, then we'll move on.
Right, okay.
But you have it's a pretty big window. 2 to 6 months is a 4-month window.
Right, but those vaccines, they come in, like 10 doses, like a month or so, right? I know it's not an exact.
Yeah, it's not, there isn't, and sometimes we can wait up to 6 weeks, sometimes we can get them in 2 weeks, so.
Okay.
There's just, we're at the mercy of the distributor.
Right.
What happens if you go beyond the 6 months? Does that make everything null?
No, it does not make it null, you'll just get it when you can. Whenever you get an immunization, the first one gives you, really kicks off that immunity very well. The second one is kind of, let's just say, to finish it up and lock it in place. So, if you go 8 months or so, the recommended is between 2 and 6 months, but you would still get that second vaccine when you get to it.
So it doesn't nullify it?
It doesn't nullify it. Certain vaccines do, but not that.
So you told us, and do you actually make an appointment, or do you have all this out?
What we'll do, typically if somebody from the community were to call, we would do exactly that. We would set up an appointment with them, and it's not an open clinic. You do need to make an appointment. So we would either do that. We are planning on coming back here and doing it for people who register through North Branford Seniors, through the center here. And then in that case, we would call, you would know when the date is. But if you weren't available the day we were coming to do it, then you can set up an appointment individually at the health department.
Because he lives in Branford, so he's closer to your
Yep, so you could make an appointment and come into Branford to get that done.
So you can make an appointment.
And that's the good thing about providing me with your information. When I call you when I call you to tell you what your copay would be, you can then negotiate how you want to manage when you get your shot when we call.
He can't hear you right now. So.
Okay, well, let him know. Are you with him?
Yeah, if you come up close.
Is this going to be different than a pharmacy? Is it going to be different in cost?
I don't know what your cost would be at the pharmacy. You would have to call the pharmacy.
I'm just wondering, do they charge differently?
I don't know. I don't know. I don't work at a pharmacy. I don't know how their process works.
My guess
I would guess no. If you have straight Medicare, whatever your copay is through Medicare, that's what your fee would be. It's not different for that. But if you have copays and other insurances, that may factor in, but I don't know.
So this is covered under Medicare, not under your prescription. It's not under.
It could
Part
be.
D.
I do. It's covered under Medicare Part D when you get it through the East Shore District Health Department.
It is.
If you have other insurances through other people, I would suggest that you contact the pharmacy, give them all your insurance information, and ask them what it would cost you. So I can't say which one is going to be less expensive. And again, sometimes people are like, well, for the extra small savings that I get using all my insurances, I'd rather get it when I can versus continue to wait until the person that's going to give it to me at the least expensive rate has it. But that's an individual choice.
Yep.
Okay. All right. Well, thank you. Thank you.
Thank you.
Thank you.